I'm Catherine, and today we'll be talking about the Thomas test. This test tests for hip contractures, and specifically we're going to be looking at stiffness in the iliopsoas muscle, the rectus femoris muscle, and your TFL. And these types of stiffness can be caused from injury or just from repetitive stress and flexion of the hip. So we're going to have our patient Maddie laying down, and we're going to say that this is her affected hip. So what she's going to do is I'm going to check to make sure that her lower lumbar spine is flat on the surface, and I'm going to ask her to bring her unaffected hip up into her chest and hold it down. And so what we're seeing here is like a negative for this test, but a positive would be that if you're looking to see if this affected knee, or the affected side, if the knee flexes rather than stays at 0 degrees. And so that would be looking at your iliopsoas muscle stiffness. But if her hip was to be in the abducted position, then that would indicate TFL stiffness. And if she wasn't able to bring this knee fully past 90-degree flexion, then that would indicate rectus femoris stiffness. And so there's also another modified version of this. So Maddie, I'm gonna have you come forward. And she's gonna sit at the end of the table, like up. And I'm gonna have you bring both knees. You're gonna hug them as you lay down. And that's just to ensure that just looking out for the lumbar lordosis, making sure her lumbar spine's fully flat on the ground. And so I'm gonna have her do the same thing. So you're gonna take your affected side hip and bring that down while you hold this into your chest. And you're just gonna have it just drop down. So if, say if this side were to be like more or extended more than 100 degrees, then she would have a tight rectus femoris. And then if this leg were to be abducted, then that would indicate a tight TFL stiffness. So basically like the same things, but this, the iliopsoas stiffness, this would be a positive test if her thigh were to be elevated like so. So right now she's negative for all those types of stiffness and for hip contracture. And the typical sensitivity is 25%. There wasn't too much on specificity. So thank you, Maddie, for coming in and being my patient. You do not have hip contracture. Thank you.